So that was the Prime Minister leading the federal government's financial response to the COVID-19 outbreak, which, as we know, has now been declared a pandemic by the World Health Organization. Is the more than $1 billion in federal funding going to the right places, and is it enough to deal with the growing public health challenge in this country over the COVID-19 outbreak? From the foyer of the House tonight, I'm joined by Nova Scotia Liberal MP Sean Fraser, the Parliamentary Secretary to the Minister of Finance. Matt Jeneroux is an Alberta Conservative MP and the health critic for the official opposition. And Lindsay Mathyssen is an Ontario New Democrat MP and her party's Deputy Whip. Good to see you all. Thanks for being here. Mr. Jeneroux, let me start with you. We've just heard at length from the Prime Minister about the financial supports being unveiled today to deal with the impact of the COVID-19 pandemic now. What's your party's reaction to these measures?
Yeah, Peter, thanks for having us on. It's certainly, after 6 weeks of asking these questions, what's going to happen with either an aid package or allowing us to be privy to some of the conversations that are happening. Finally, we see something here today. There's certainly a lot of elements that involve the provinces and territories, and they'll have to sort out through some of those themselves. But however, at the end of the day, we want to make sure this isn't a partisan issue. This is a Canadian issue, and we want to make sure that the health and safety of Canadians is the first priority. And after that 6 weeks, it's certainly welcome to see the Prime Minister finally being engaged on this file.
All right. So you think this is a good step forward? You think that this money being announced today is at least a positive move here by the federal government?
I think, the Prime Minister indicated that this was a potential first step, and that's what we're curious to see. There certainly doesn't appear to be a lot of room in a cushion and for a budget and ballooning deficits and the amount of debt that this government has put on. However, we want to make sure that the health and safety of Canadians is the priority here, and certainly prepared on our opposition side of the House to support as much as we can to make sure that that Canadians are getting the answers that they need.
Lindsay Mathyssen, what does your party think about these measures from the government today to deal with the COVID-19 pandemic?
Again, what Matt had said is absolutely true. We're 6 weeks into this issue, and it's only now that we're seeing any sort of reaction from the government as needed, but 60% of workers are not going to be helped by this $1 billion. We know that the people who serve our food, they're working in the service industry. 47% of Canadians are $200 away from insolvency, and all of these people, they can't afford to take sick days. They don't apply, or they don't get EI in the first place. They won't be able to access that, and so they can't afford to miss those days of work.
Right. So
and for them,
to be clear, the package announced by the government today, it's $5 million towards allowing people who are eligible for EI sickness benefits to have the 1 week eligibility period waived so they can collect it immediately. But as you point out, a whole lot of people don't have access to EI benefits.
These are people on the front lines, absolutely. They're people who are self-employed as well, and these people they cannot afford. They don't have the access to it, but they also can't afford to take the time off. For them, 1 day, 2 days, 3 days off of work, they want to make sure that they don't have to pass along this illness, but they can't afford to do that. It means they can't afford rent. It means that they can't afford the food that they need to put on the table for their kids.
Mr. Fraser, what about that? What's in this package for workers who may be off work because of the outbreak but are not eligible for EI sickness benefits?
Well, first, I think we have to remember that our priority is to ensure that Canada's public health system can offer a world-class response to limit the spread of this illness. Of course, of the $1 billion package announced today, $500 million is going to the provinces and territories to help meet the needs to actually take care of folks in communities across Canada and to prevent the spread. We recognize, to your question, that there's also an economic element of this for workers and businesses as well. That's why we did announce new measures through the EI system for workers and changes to the work-share program for employers as well. To my NDP colleague's point, there will be income support for individuals who don't qualify for EI, and the precise mechanism is under consideration to make sure that those benefits are delivered most effectively. Today is only one step in our approach of some that have already happened, and I expect more to come.
What do workers who do need to access these benefits, or will need to access them, what do they need to know about how they go about it? Are they going to have to get a doctor's note? Or are they going to have, what procedures are they going to have to follow to be able to claim these benefits if they can't work?
So the ordinary process of applying for EEI would suffice. So contact your Service Canada outlet and they'll walk you through the particular process. The focus on our end is to make sure that obtaining these benefits can be done in an expedited way, and the process of applying for those benefits is simple and straightforward.
All right. Mr. Jeneroux, the $500 million to the provinces, it's supposed to be for, making sure that they're prepared to deal with a wider outbreak, that they have the systems in place, the equipment they need. But we've heard lots of concern from provinces and from healthcare professionals that there are problems with enough equipment to deal with a wider outbreak here. Do you have concerns about whether or not what that money is going to be used for, and whether $500 million goes far enough with 13 provinces and territories?
I think you're exactly right, Peter. When look at what we're hearing from provinces and hospitals and health officials, is that they don't know how many beds will be needed, what the expectations are put on them for masks, for ventilators. We're hearing from Northern Ontario that they don't have enough ventilators. All of these questions, I don't think just sending $500 million and saying this is blanket, this is what it's for, is necessarily what is going to give Canadians confidence that we now have enough beds and protective equipment. So I think there's certainly some of those details that need to be sorted out. I would like to hope. I don't know if $500 million is enough for hospital bed prices or not, but I'd like to think that the government has some of these numbers somewhere. It's just that there seems to be an inordinate amount of secrecy about whether or not this is enough money.
Lindsay Mathyssen, let me hear you on that. Do you have concerns about exactly how this money is going to be dispersed, and who will make decisions about what it's for? Is there, and we'll get to Mr. Fraser, we'll ask him about the strings attached part two, whether there are. What questions do you have about this money flowing to the provinces?
Absolutely. There are so many unanswered questions, and the government has a great deal that they could be doing. They need to work through a lot of this. But again, we get to the number of people that are left out of this announcement, and we don't have any answers for that 60% of people, those service workers, those healthcare workers, those people that are living paycheck to paycheck. We don't have answers for them. And the government can't just simply say, oh, wait, it'll come. Those answers need to be now, and they've certainly had the time to do it, and they really need to act on this right away.
Mr. Fraser, what about those two sort of questions? Is the government confident that at this point $500 million is enough for 13 provinces and territories, and specifically, are they being told what to do with that money?
They're not being told what to do. There is a conversation going on as between the provinces, territories, and federal government, of course. And in fact, the response between different levels of government and, in fact, our international partners has been coordinated from the very beginning. We recognize that the challenges that may be facing British Columbia may not be the same as those in Nova Scotia, where one province may need additional beds or respirators, another may need to improve their monitoring capacity. We're going to be flexible in the approach to ensure that the money can actually target the needs at the provincial or community level as needed. Any other approach would be foolhardy. We have to ensure that the capacity of the public health care system where Canadians live is actually meeting their needs. The trick here is going to be ensure that there's not such a quick spike in cases that the capacity of the public health care system is overcome all at once. And to ensure that doesn't take place, we're going to have to tailor the investment on a province by province or community level to the needs in that specific region.
That's I guess that takes me to my next question. One of the big questions here is how bad could this get? And this is this whole conversation about trying to soften that curve as cases begin to rise. Mr. Jeneroux, let me ask you, at the Health Committee today, there were questions for the Health Minister and the Public Health Officer, the Public Health Agency, about their expectations for this range of 30 to 70%. What did you hear, and are you satisfied that we have a plan in place that's ready if it's at the upper end of that range for the number of Canadians who end up getting infected?
I think that's really the point, Peter, is that we're unsure of what that plan is. I certainly can appreciate that the minister doesn't want to incite any sort of hysteria. However, there's certainly a lot of unanswered questions right now. There was a comment that the minister actually didn't make, and when it was interpreted to go in stockpile, the minister didn't actually say for Canadians to go in stockpile. She essentially just referred to the season, being the flu season, like you normally would. But that has incited a lot of people to go and stock up on medication and food. So what we've been critical of is that there's just that lack of transparency and really, again, an inordinate amount of secrecy around what should we be doing if it gets that bad? Should we be prepared that it is going to get that bad? Again, there just seems to be a lot of secrecy that we're waiting for the minister to tell us.
Lindsay Mathyssen, let me hear, is it reasonable at this point to have some of that ambiguity and some of that lack of certainty over things like ranges? I mean, how do we know how bad it could get?
It's really hard to say in terms of what the government's provided today, that's for sure. There isn't that strategy, there isn't that clarity going forward. They've had some time to prepare for this, and they haven't done the job that they need to do for the majority of Canadians that are looking to them for the leadership that they need. We can also look to cases we haven't talked about Indigenous communities here yet, but they talked to them and said, oh, well, you need to wash your hands more, or you need to self-isolate or self-quarantine. But when you're living in inadequate housing, where you can't, when
Right.
you can't even wash your hands, you don't have clean running water, these are issues that they haven't dealt with and they really need to.
We're going to hear more about that in a few moments on this program, because Perry Bellegarde, the Grand Chief of the Assembly of First Nations, National Chief, is going to be talking to me about that. So, Mr. Fraser, a quick final comment to you. The government seemed to suggest today this was a first cut at providing this kind of funding to deal with this pandemic as we watch where it goes. That suggests that budget coming up March 30th. Should we expect to see more on that and perhaps hear more about it at the First Minister's meeting in the next couple of days?
Well, I wouldn't necessarily think that the entire answer has to be included in a federal budget. Of course, we had measures announced today in advance of the budget because we needed to take action. It included the $500 million for the province, $275 million in research. To my colleague's comment about Indigenous communities, $100 million was dedicated to a series of initiatives, including support for Indigenous communities.
But we've heard from the business community, for instance, today that they're happy with what was here for workers, but they need to hear more about providing some breaks for business if this gets really bad.
I'll note as well that part of today's announcement included the fact that we're going to be making credit available as we need to through Export Development Canada or
Right.
the Business Development Bank. One final comment, maybe to conclude. Every step of the way, our approach is going to be informed by the best science, facts, and evidence available. We're following the advice to the letter of the Public Health Agency of Canada, which was designed specifically to assist in circumstances such as these.
Okay, thank you all. Good to talk to you tonight about this, and we'll watch as the story continues to unfold, but appreciate your contributions to the conversation tonight. Thanks.
Pleasure.
Peter.